Navigating Healthcare in Kenya, a Guide for American Retirees. Introduction. Retiring abroad is an increasingly attractive option for Americans seeking adventure, affordability, and a change of pace in their later years. Kenya, with its stunning landscapes, vibrant culture, and relatively low cost of living, has emerged as a compelling destination. However, one of the most consequential and most frequently underestimated aspects of such a move is healthcare. For an American retiree accustomed to the structures of Medicare, employer-sponsored insurance, and a highly regulated hospital network, Kenya's healthcare landscape will require substantial preparation, a willingness to learn new systems, and a clear-eyed understanding of both what is available and what is not. This essay provides a comprehensive overview of how a retiring American can effectively navigate Kenya's healthcare system, from securing insurance before departure, to understanding the structure of the Kenyan health sector, to building the day-to-day habits that protect health and manage risk in a new environment. Part 1. What you must do before you leave the United States. Understanding the Medicare gap. The first and most important fact for any American retiree relocating to Kenya is this: Medicare does not cover medical expenses outside the United States, with very limited exceptions that do not apply to routine expatriate living. Original Medicare, Parts A and B, provides essentially no international coverage. Medicare Advantage plans occasionally offer limited emergency coverage abroad, but none of these plans are designed to support a retiree living permanently in another country. This means that a retiree who lands in Nairobi with Medicare as their only health coverage is, for all practical purposes, uninsured. The implications of this cannot be overstated. Kenya's top private hospitals, where care for expatriates is generally delivered, operate on a fee-for-service and pre-authorization basis. Without coverage, a single hospitalization can cost tens of thousands of dollars. Securing international private health insurance. Before relocating, every American retiree should secure a comprehensive international private health insurance policy. Several reputable global insurers offer plans specifically designed for long-term expatriates, including Cigna Global, Aetna International, Allianz Care, and AXA Global Healthcare. When evaluating plans, retirees should prioritize the following features: inpatient and outpatient coverage. A robust plan should cover both hospitalization and routine outpatient consultations. In Kenya's private sector, outpatient visits, diagnostic tests, and specialist consultations all carry significant costs that accumulate quickly without coverage. Medical evacuation. This is non-negotiable. In a serious medical emergency, a cardiac event, a major trauma, a complication requiring highly specialized care, the ability to be evacuated to a higher capability facility, whether in South Africa, India, or back to the United States, can be the difference between life and death. Medical evacuation coverage should be a baseline requirement, not an optional add-on. Pre-existing condition terms. Retirees should read policy language carefully regarding pre-existing conditions. Some international insurers impose waiting periods or exclusions. Others offer full coverage with higher premiums. Given that most retirees manage chronic conditions like hypertension, diabetes, or arthritis, this clause deserves careful attention. Direct billing relationships. The best international policies have direct billing arrangements with major Nairobi hospitals, such as the Aga Khan University Hospital, Nairobi Hospital, and MP Shah Hospital. This eliminates the need to pay out-of-pocket and seek reimbursement, a process that can be slow and administratively burdensome. Medication and medical records. Before departure, retirees should obtain a sufficient supply of all prescription medications, typically 3 to 6 months, to allow time to establish care with a physician in Kenya and source equivalent drugs locally. They should also carry comprehensive medical records, a current medication list with generic drug names. Brand names differ internationally, surgical history, specialist reports, vaccination records, and results of any recent major diagnostics such as cardiac stress tests, colonoscopies, or imaging studies. Kenya's private pharmacies stock a wide range of medications, and generics are broadly available, but the transition between supply chains takes time to navigate. Arriving with a medication bridge and proper documentation ensures continuity of care from day one. Part 2. Understanding Kenya's healthcare system. The structure of the system. Kenya's healthcare system is organized into a tiered structure that spans both public and private sectors, and understanding this structure is essential to knowing where to seek care, what to expect, and how much it will cost. The public sector is anchored by national referral hospitals, most notably Kenyatta National Hospital, KNH, in Nairobi, and Moi Teaching and Referral Hospital in Eldoret. Below these are county referral hospitals, sub-county hospitals, health centers, and dispensaries. This network serves the majority of Kenya's population of over 50 million people and is funded primarily through government budgets and donor support. Care in public facilities is subsidized and generally inexpensive, but the system operates under significant strain. Chronic underfunding, staff shortages, long queues, and inconsistent availability of medications and equipment are well-documented challenges. The private sector, concentrated primarily in Nairobi, Mombasa, Kisumu, and Nakuru, offers a substantially different experience. Hospitals like the Aga Khan University Hospital, Nairobi Hospital, MP Shah Hospital, Karen Hospital, and Gertrude's Children's Hospital are well-equipped, staffed by many internationally trained physicians, and capable of delivering care that meets or approaches international standards. These facilities maintain modern diagnostic laboratories, imaging suites, intensive care units, cardiac catheterization labs, and surgical theaters. For a retiree with solid private insurance, this tier of the healthcare system is largely accessible and, in many cases, excellent. Mission and faith-based hospitals represent an important middle tier. Facilities such as Mater Hospital and various church-sponsored hospitals across the country offer a range of services at costs that generally fall between the public and upper private tiers. Some of these institutions have strong reputations in particular specialties and are worth knowing about. The National Social Health Authority, SHA. Kenya has undergone significant reform of its national health insurance infrastructure. The former National Hospital Insurance Fund, NHIF, which operated for decades as the primary public health insurer, has been restructured and replaced by the Social Health Authority, SHA, established under the Social Health Insurance Act of 2023 and progressively rolled out from 2024 onward. The SHA aims to move Kenya toward universal health coverage, UHC, by consolidating multiple health funds under a single framework. Legal residents of Kenya, not only citizens, are eligible to register as contributors to the SHA. For a retiree on a long-term resident visa, enrolling in the SHA provides a supplementary layer of coverage, particularly for inpatient care at participating facilities. While the SHA should not replace a comprehensive international private insurance policy, enrollment offers meaningful additional protection and integrates the retiree into Kenya's formal health financing infrastructure. Understanding hospital levels. Kenya's Ministry of Health classifies health facilities by level, from Level 1, community health units, through Level 6, national referral hospitals. For a retiree, the most relevant tiers are Level 4 facilities are county hospitals offering inpatient care, surgery, and a range of specialist services. Private Level 4 hospitals are widely available in Nairobi. Level 5 facilities are regional referral hospitals with broader specialist capacity and more complex diagnostic capability. Level 6 is reserved for national referral hospitals, KNH and MOI, as well as institutions like the Aga Khan University Hospital, which has been accorded equivalent status given its teaching and specialist functions. Part 3. Building a healthcare infrastructure in Kenya. Establishing a primary care physician. The single most important healthcare action a retiree can take in the first weeks after arriving in Kenya is to establish a relationship with a primary care physician or general practitioner at a reputable private clinic or hospital. This physician becomes the cornerstone of the retiree's care, managing chronic conditions, handling prescription renewals, coordinating specialist referrals, and providing the continuity that a fragmented system would otherwise not offer. In Nairobi, many private GPs have received postgraduate training in the United Kingdom, United States, South Africa, or India, and are highly capable clinicians. Asking a trusted expat community or a relocation service for a GP recommendation is often the most reliable path. The Aga Khan and Nairobi Hospital both have outpatient medical centers with large rosters of GPs from which to choose. Navigating specialist care. Kenya's private hospitals maintain panels of specialists across most major disciplines: cardiology, orthopedics, gastroenterology, oncology, nephrology, ophthalmology, and more. Unlike the United States, where specialist referrals are often tightly gated through insurance networks and primary care gatekeeping, Kenya's private sector allows a degree of self-referral. A patient can, in many cases, book directly with a specialist at a private hospital. However, retirees should approach specialist selection thoughtfully. Credentials, training backgrounds, and subspecialty experience vary. It is worth asking where a specialist completed their training, whether they hold relevant certifications, and what volume of a particular procedure they perform annually. Top specialists at facilities like the Aga Khan University Hospital are internationally competitive, while quality at smaller private clinics can be uneven. For conditions requiring highly specialized intervention, complex cardiac surgery, neurosurgery, advanced oncology, many expatriates and well-insured Kenyans travel to facilities in India, particularly Chennai or Mumbai, South Africa, Johannesburg or Cape Town, or the United Kingdom. A good international insurance policy will cover medically necessary travel of this kind, and the retiree should understand the pre-authorization process for such referrals before they are needed. Pharmacies and medication management. Kenya has a well-developed retail pharmacy sector, particularly in urban centers. Chain pharmacies such as Goodlife Pharmacy, Halton's, and Portal Pharmacy, as well as independently owned outlets, stock a broad range of medications, including most common chronic disease drugs. Generic versions of most essential medications are available at significantly lower prices than branded equivalents. An important cultural distinction for the American retiree. Kenyan pharmacists play a more expansive role in primary health care than their American counterparts. For minor acute illnesses, upper respiratory infections, mild gastrointestinal complaints, common skin conditions, it is entirely normal and accepted practice for a Kenyan to consult a pharmacist directly and receive appropriate medication without a prior physician visit. For chronic medications, retirees should ask their GP to write prescriptions using generic international non-proprietary names, INNs, rather than branded names, to facilitate sourcing at any pharmacy. Part 4. Day-to-day health management. Maintaining personal health records. Kenya's private hospitals are progressively adopting electronic health records, but data sharing between institutions remains inconsistent. A patient who sees a specialist at Nairobi Hospital, then attends an emergency at MP Shah, cannot assume that records will be automatically shared between systems. Retirees should therefore maintain a personal health file, either physical or digital, containing their current medication list, allergy profile, surgical history, recent laboratory results, imaging reports, vaccination records, and contact details for their GP and any active specialists. Understanding health risks. Specific to Kenya. Kenya presents certain health risks that are absent or negligible in most of the United States, and retirees must understand and actively manage these. Malaria is endemic in many parts of Kenya, including coastal areas, the Lake Victoria Basin, and low-altitude regions, generally below 1,500 meters. Nairobi, at an altitude of approximately 1,795 meters, is considered low risk but not zero risk, particularly during rainy seasons. Retirees should consult their physician about appropriate malaria chemoprophylaxis if they plan to travel to higher-risk regions. Water and foodborne illness are real risks, particularly for those newly arrived. Retirees should drink filtered or bottled water, be cautious with street food and salads washed in untreated water, and keep oral rehydration salts on hand for gastrointestinal episodes. Altitude affects some retirees, particularly those with cardiac or pulmonary conditions, when visiting highland areas above 2,500 meters. Altitude-related symptoms should be taken seriously and discussed with a physician before travel to higher elevations. Vaccination is an important preparatory step. Standard vaccinations recommended for Kenya include hepatitis A and B, typhoid, yellow fever, rabies, and meningococcal meningitis. Retirees should confirm vaccination status with a travel medicine specialist before departure. Emergency preparedness. Every retiree living in Kenya should have a clear emergency plan. This means knowing the location and contact number of the nearest private emergency department, understanding how their insurance handles emergency authorizations, and having the number for a reputable ambulance service saved in their phone. AMREF's Flying Doctors Service, which provides both ambulance and air evacuation services, is widely used by expatriates and is often included in or compatible with international insurance policies. Kenya's national emergency number is 999 or 112, but response times and capabilities vary significantly depending on location. In Nairobi, private ambulance services generally offer more reliable emergency response for the expatriate community. Conclusion. Navigating Kenya's healthcare system as an American retiree is neither simple nor effortless, but it is entirely manageable with adequate preparation, the right insurance, and a clear understanding of the landscape. The system is not monolithic. It spans gleaming private hospitals on par with international standards and a strained but dedicated public network that serves millions. For the retiree with comprehensive international coverage, a trusted primary care physician, and a working knowledge of where and how to access care, Kenya offers a genuinely viable healthcare environment, one that, in many respects, delivers attentive, relationship-centered medicine that American patients often find they had been missing. The transition demands humility about one's own assumptions, patience with processes that do not mirror the familiar, and a commitment to building knowledge proactively rather than reactively. Healthcare in Kenya, like healthcare everywhere, rewards those who engage with it as informed, active participants. For the American retiree willing to do that work, the rewards, both in care quality and in the broader experience of life in Kenya, are considerable.